Hello, my name's Dr. Williams. I'm a vascular surgeon, and I'm here to talk to you about carotid artery disease and the options for treatment. The classic treatment for carotid artery disease is a procedure called endarterectomy. When plaque builds up in the carotid artery, there is a danger of blocking blood flow to the brain, and a patient's risk for stroke increases dramatically. By performing an endarterectomy, we are removing the plaque and therefore removing the blockage in the artery in order to restore normal flow. This procedure is performed in the hospital, in the surgical suite, under general anesthesia, so that a patient is completely asleep during the procedure. The artery is opened, a shunt is placed in the artery so that blood flow to the brain is preserved, and then with a special instrument, the plaque inside the vessel is very carefully removed all in one piece. People often ask me after the plaque is removed, how much blockage will they have remaining? And the answer is that there will be no blockage whatsoever. The plaque is removed in its entirety, and this is one of the advantages of the surgical technique. And it is why the surgery has such a good long-term, durable repair of this condition. The postoperative course is usually very short. The pain from the incision is minimal. Patients do very well and recover very quickly as long as there was no neurologic problem resulting from the surgical technique. Because of this, this procedure is one of my favorite operations to perform. Most people are in the hospital 1 to 2 days. After they leave the hospital, they are checked again in 1 week to be sure that the incision has healed properly and that there are no difficulties with swallowing, since this is a procedure which is performed on the neck. In addition to the surgical approach, most patients with carotid disease are asked to take a baby aspirin indefinitely to prevent recurrent narrowing and to thin the blood to maintain flow to the brain. The second option for treatment of carotid artery blockage is the placement of a stent. This avoids the problem of anesthesia, and in a very high-risk patient in whom we are concerned about performing surgery, this allows the carotid condition to be taken care of with the patient awake while the procedure is performed. This is done in the surgical suite or in the radiology department. A catheter is placed in the groin, and under fluoroscopy, the catheter is positioned from the groin into the neck right at the point of narrowing. A balloon is inflated, and then a stent is placed over the inflated portion of the artery to keep the artery open. The plaque isn't actually removed, it's smashed into the walls, but it does accomplish the objective of reopening the artery. This procedure should be reserved as a backup procedure for people who are extremely ill. For example, in somebody who's had numerous heart attacks and we are concerned about giving that person anesthesia. It's also ideal when a person's narrowing is in a very unfavorable position, so that trying to make an incision would not provide the proper exposure in order to do the operation. If a patient has had prior radiation, concerns about healing the neck wound are paramount, and carotid stenting is therefore the preferred procedure in that instance also. Another indication for carotid stenting would arise in the situation in which the patient develops recurrent narrowing of the artery after surgery due to scar tissue. Reoperating in this situation poses a much higher risk, particularly for nerve injury. And in this instance, using a stent can redilate the artery without having to make an incision and subjecting the patient to a second operation. So I think that carotid artery disease, because of its potential risk for causing problems with stroke, can be addressed usually with an operation. But for those people who are high risk for surgery, considerations of stenting come into play, and this two-armed approach allows us to treat most of the carotid problems quite successfully.